I love my job because I get to come in every day and help kids.
Children didn't put themselves in the spot that they're in. A lot of times they don't even know why they feel the way they do, and to be the person that comes in and fixes that is like it's a great feeling.
It's about you developing your own skills so that by the time you're done, even by the time that you're a third year, you're ready to go.
They do let us kind of lead everything, but they also are there for us if we get stumped for some reason. And it's always kind of like a very great interaction where we get a lot of autonomy, but we also have support and we know that we have that.
I think simulation is a huge benefit or advantage that we give to our fellows here. We do simulation at least once a month for all of our fellows one-on-one. And not only that, but we also do in situ simulation in the emergency department with our nursing staff and respiratory staff too as well. And these give the opportunities for our fellows to have tons of more learning opportunities than they wouldn't typically get on a regular basis just by working their clinical shifts in the ER.
Every day is something new, and every day is something that I can definitely learn from.
I mean, thrown into the fire isn't like a bad way to put it because it's a great way to get like your training. We always have the support of our attendings there, but the best way to learn is to do.
We treat our fellows just like faculty too as well, and they're teaching and leading our department just as much as everyone else. And that's what we want when we're training fellows.
Our fellowship, we have a longitudinal shift schedule. What that means is that our fellows do 264 shifts within their 3 years. We spread that over 24 months to incorporate our research blocks as well. It really gives them the control over how they're going to schedule and how they're going to experience their shifts while they're here.
Each faculty has shown me different ways of how I can grow, different ways of how to approach different patients, and that's really helped me grow altogether as a physician.
We have faculty from different backgrounds. It helps create a great framework for our fellows to learn different approaches to every problem, to learn that there isn't really one way to do everything, and to get a little different flavor from everyone.
I'm still just finishing first year fellowship. I still have a lot to learn, but I can tell you in that first year, you get a lot of exposure and you become a lot more comfortable.
There's no better example than what's happening in the world right now as to why what we do is so important. I think that you need doctors that are expertise in both pediatrics and peds emergency medicine for these reasons. You need to be able to have that wide range of experience and education to help with all of the problems that are coming in the ERs.
One unique thing about our fellowship is that we've created this system that there's different tracks if the fellows have a particular interest. Some fellows had an interest in education, simulation, there's an administrative track, an ultrasound track, and really this is us as faculty members being really supportive of the specific interests of our fellows and just kind of fostering that.
We also have them outlining all of their research at the same time and any of their administrative experiences, because we really try and have a couple of arms to their training. We want them to be proficient in research from start to finish, have published a manuscript before they graduate, as well as 2 case reports so that they really have done everything they need to do to go on their own.
We are a small program within like a very big emergency center that sees like 100,000 patients per year. So we benefit from our pediatric emergency medicine faculty and all their knowledge, and then like the extensive knowledge that our adult ER docs provide as well.
If you want to understand how to manage a very busy pediatric emergency department, then this is a place to be.